Great. Welcome, everybody. Thank you for joining us this afternoon. In honor of Asian American and Pacific Islander Heritage Month, welcome to the Status of Asian and Pacific Americans in UCSF webinar. This event is sponsored by the AAPI Coalition, APASA, APANSA, Asian Health Institute, BCH DEI and Anti-Racism Council, UCSF Office of Diversity and Outreach, and the United Filipinx Association. My name is Wiley Liu, and I'll be your moderator for today's webinar. I serve as the Executive Director of the Center for Community Engagement, as well as the Anchor Institution Initiative. I'm very honored also to be on the steering committee of both APASA and AAPI Coalition. We have a great webinar planned for you this afternoon. You will hear about the status of API at UCSF, a panel discussion, and some closing remarks from the AAPI Coalition co-chairs. I will start with inviting Dr. Hanmin, who will provide welcoming remarks. It is my pleasure to introduce Dr. Lee to you. He is a director of surgery for pediatrics and OBGYN. Dr. Lee is Surgeon-in-Chief and Director of Fetal Treatment Center and executive sponsor of the Diversity, Equity, Inclusion, and Anti-Racism Council at Benioff Children's Hospital. Dr. Lee.
Thank you, Wiley, for that kind introduction. Can everybody hear me okay? Thumbs up?
Yes.
Thank you. Thank you to the leaders of the AAPI Coalition for giving me this honor and privilege of making some remarks during today's seminar on the status of Asian Pacific Americans at UCSF. I'm incredibly grateful for the chance to be a part of this effort to bring visibility to our community, which often is so often made to feel less visible than we should be. I was alarmed to hear at a recent meeting that in a poll of Americans asked to name a famous Asian American, the most common answer by almost fourfold was none. Second was Jackie Chen at 11%. Of note, Jackie Chen is famous, but is not Asian American, he's Asian. It's also amazing considering that the Vice President of the United States, Vice President Harris, is Asian American, just to name one. It highlights the issue of lack of visibility of Asian Pacific Americans in the United States. Parallel to the need for increased visibility is the need for all of us to be recognized and visible as individuals rather than as a stereotypical minority, even if we're the quote unquote model minority. Personally, my family moved to the United States from Korea in the late 60s when I was a young child. I grew up mostly in Georgia, almost always the only Asian kid in class and often in the whole school. Being different and sticking out, I wish that I was more anonymous and less visible then, but what I realized now I wanted was not to be unseen, but to be seen for who I was as an individual rather than having the pressure to fit in to the models seen on TV and movies. I feel so lucky 50 years later to live in San Francisco, where an Asian Pacific American can be accepted for whatever their interests are, be they math or art, violin or drums, ping pong or rugby. But even in San Francisco and the greater Bay Area, so many challenges exist for us to be visible and represented as individuals. Still, we see the world through so many more windows into the lives of others than mirrors that reflect us. Windows and mirrors are both critical, but everyone needs a balance of both. Today is a wonderful opportunity for us to see ourselves reflected in each other while also having individual characteristics. Each one of us is unique and deserves to be seen as such. Symposiums like the one today will help us to amplify our voice and agency individually and collectively so that we can best advocate for ourselves and others, including those under our care at UCSF. Thank you all for participating. I look forward to today's program. And again, thank the AAPI Coalition leaders for being able to participate and organize us. I'm also grateful to introduce next my colleague, Henry Ocampo. Henry holds an MPH from Berkeley in health and social behavior and has over 25 years in the field of health equity. I've been blessed to work with Henry in his role as lead for the UCSF Benioff Children's Hospital's By-Campus DEI and Anti-Racism Council where he has truly elevated our ability to advocate for DEI and anti-racism and health equity, both for our workforce and our patients and our families. Henry?
Good afternoon, everyone. My name is Henry Ocampo, and I'm the Program Manager for Diversity, Equity, Inclusion, and Anti-Racism with the Benioff Children's Hospitals. And I'm also the co-chair of the AAPI Coalition. One year ago, in April 2021, various UCSF AAPI groups gathered to collaborate and coordinate events for May's AAPI Heritage Month and focus on anti-Asian hate. The weekly planning meetings garnered support from more than 40 Asian individuals, groups and programs, leading into the formation of the AAPI Coalition. The coalition was registered as a UCSF campus organization in July 2021, and a steering committee was formalized as January this year. The purpose to serve as a liaison to UCSF leadership in executing the recommendations and action items from the joint statement. Our co-chairs is one faculty, one learner, and one staff, which includes Dr. Don Ng, William Ho, and myself. And here are some member organizations in the coalition. By May of last year, the coalition also developed a joint statement that outlined 6 recommendations and a proposed action plan intended to make positive impact on the learning, clinical, research, and working environment for APIs, and to further advance the DEI initiatives at UCSF. The joint statement was endorsed by over 20 campus departments and groups and more than 2,000 UCSF community members, including our students, learners, staff, faculty, and researchers. The joint statement was presented to our UCSF Chancellor Sam Hawgood and former CEO and President Mark Lorette and leadership team on June 24th, 2021, to discuss a plan to address these 6 recommendations. These recommendations include, number 1, increasing the awareness and understanding of our AAPI history and culture, dispel the AAPI-related myths, and to affect changes in the perceptions of AAPIs. 2, improve data transparency and reporting by race on regular basis with API data further disaggregated for students, learners, employees, patients, and research participants. Number 4, increase API representation at the senior and executive level management positions across institutions, along with training and support. Number 5, including APIs when using the URM, underrepresented medicine term, in DI initiatives and communications. And 6, recruiting bilingual students to become interns to build pipelines of future bilingual healthcare workers to be in concordance with the language needs of our 35% APIs in San Francisco. Also want to give a quick overview of who are Asians and Pacific Islanders. According to the United Nations, Asia is the largest and most populous continent with over 4.7 billion people. Asia comprises 30% of the world's land area with 60% of the world's population. It also has the highest growth rate, with population almost quadrupled during the 20th century. According to the United Nations, there are about 48 Asian countries that encompasses 5 regions: Central, South, East, Southeast, and West Asia. Also, according to the United Nations, there are about 2.3 million Native Hawaiians and Pacific Islanders in the world, spread across Micronesia, Melanesia, and Polynesia, and make up about 15% of the world's surface. Native Hawaiians and Pacific Islanders make about 26 different island nations and territories and the US state of Hawaii. The ones in red are affiliated with the United States, including American Samoa, Hawaiian Islands, Commonwealth of Northern Mariana Islands, Federated States of Micronesia, Guam, Republic of Palau, and the Republic of Marshall Islands. Locals also refer to this region as the Blue Continent. According to the US Census data, Asians are defined as people in the East Asia, Southeast Asia, and Indian subcontinent. In the 2019 census, there are about 24 million Asians living within the US, which is about 7.2% of the US population. Also, about 1.6 million Native Hawaiians and Pacific Islanders make up about 0.5% of the US population. I can see that the Bay Area has a higher percentage of Asians and Pacific Islanders as compared to the national average. As for economics, Native Hawaiians and Pacific Islanders have a median household income about $66,000 and higher poverty rate of about 15%. The median household income of Asian Americans was about $94,000 as compared to $72,000 for whites. Yet 9.6% of Asian Americans compared to 9% of whites live at poverty level. Because this is due to the economic status that varies widely among Asian subpopulations. For example, poverty rate for Filipinos are at 5.8% compared to 14% for Hmong. As for language, nearly 30% of Native Hawaiian Pacific Islanders speak a language other than English at home. Overall, 31% of Asians are not fluent in English, and about 74% of Asian Americans spoke a language other than English at home. This also varies by Asian subgroups, with 48% of Vietnamese, 42% of Chinese, 20% of Filipinos, and 18% of Asian Indians not being fluent in English. In regards to health insurance, 66% of Native Hawaiian Pacific Islanders use private health insurance, while 34% relied on Medicaid or public health insurance, and 9.1% were uninsured. As for Asian Americans, 75% has private insurance coverage, while 26% relied on Medicaid or public health insurance, and 6.6% of Asian Americans were uninsured. This also varied by Asian subgroups. For example, for private health insurance rates was 66% for Cambodian, 79% for Filipino, 73% for Chinese, and 62% for Hmong. Finally, as for education, high school diploma rates were similar, with 89% of Native Hawaiian Pacific Islanders and 88% of Asians. 24% of Native Hawaiian Pacific Islanders and 55.6% of Asians had a bachelor's degree. And then 7.4% of Native Hawaiians and Pacific Islanders and 25% of Asians have obtained graduate or professional degrees, in comparison to 14% for whites. So that's just kind of an overview of Asian and Pacific Islanders and the US. Next, we have Jeff Chiu, our Vice President and Assistant Vice Chancellor of Talent Management and Operations and Human Resources, who's going to talk about and share our UCSF data on Asian Americans Pacific Islanders.
Thanks, Henry. Let me just put this in. So I was asked to, as Henry said, to share the data that we have of the Asian population at UCSF. And as disaggregated as it is, this data is pulled from UC Path, and it is the voluntary demographic disclosure that employees fill out at their time of hire. So here is UCSF's population compared to the 9 Bay Area County. And when I looked at Henry, I think your data said that the Asian population was 36%. Our data might be a little off from each other, because the data shows for the 9 Bay Area counties at least that it's 27.5%. And at UCSF, it's closer to 38% overall of all populations between staff and academic. And you can see that the Asian population as a whole on the health system is a little higher at 40.7%, and it's about 35.8% for the campus. When we look at the leadership composition, and I can share that I am most familiar with the staff data, and that's everything from the staff frontline all the way to the senior management group. We have included the academic, which is the faculty, as well as the non-faculty academics, as well as the trainees here, but I don't have a lot of familiarity with it. But you can see that, and this has been referenced before, that that the highest representation of the Asian population overall is at the staff frontline category and the supervisor. And then as we get into the management level roles, it starts to decline up to the top of the organization. When we look at how the Asian population as a whole has changed over the years, and this is from a time frame of 2017 to 2021, the way I see it is that in general, it's stayed pretty stable. For the senior management group, it's increased a little bit over the 5 years. For the manager level, it has increased a little bit, but it's fluctuated a little bit up and then has dropped a little bit, but stayed generally consistent with a little bit of increase. And similar for the supervisor as well. It has declined a tiny little bit, but really it's generally stayed flat. When we look at the categories disaggregated, and you can see down here, these are the different categories that exist within UC Path. What we've done here is we've looked at the disaggregation from all of UCSF as well as campus and health. You can see that the Chinese population in general is the largest for all of UCSF and campus. However, the Filipino population is larger in health than the Chinese population. And the reason there's not percentages here is that the percentages are generally small enough that even the data label doesn't show up on this grid. When you look at the representation from staff frontline to leadership again, you can see this mirrors that same decline in the Asian population up through that senior management group. But again, that in general, the Chinese population is most represented in these in each one of these levels, and then it starts to decline for some of the other populations that are represented here. When we've looked at the manager level 1 and up over the years, again, you can see that it's stayed pretty consistent throughout the years, with a little bit of improvement since the time that we started to track, with a little bit of up and down fluctuation. Again, in general, the Chinese population is the most represented among all the different populations. And here it is, again, the same chart. When you break out the senior leader and the manager and the supervisor, again, not a whole lot of fluctuation. And you can see that there have been some improvements in the manager category for the Filipino population, as well as the Chinese population, and general increases in the other Asian population as well. And you can see here the supervisor as well, some directional increases, other Asian with a little bit of a decline. So the last slide was from our fiscal year 21 Gallup Staff Engagement Survey. And one of the engagement survey, as many of you know, is one of the most consistent experience surveys for our staff. And we disaggregated by these populations that in general align with our the UC Path definitions. What was interesting was that for the most part, the population experience, so there's not a huge amount of variability. In the question around, I have the opportunity to do what I do best, you can see there's a little bit of spread over here. You can also see a little bit of spread in the opinions count, and up over in that my team is committed to quality, and even in the mission, the best friend at work, there's a little bit of a spread, but otherwise, in general, the items for the entire Asian category tend to track relatively close together. This FY22 Gallup survey results have not yet been released. The survey finished up just a week or two ago, and the individual results by the manager level will be released at the end of this week. But the cabinet results, which will have this same exact analysis, will be shared sometime within mid-June with the cabinet, and then we can plan on releasing or conveying those results for this survey at a later time. So that's all the data that I have to share, and I'm happy to answer any questions or in the panel.
Thank you so much, Jeff and Henry, for that very informative and educational status update. There was a lot of information, so save up your questions for the Q&A session for both Jeff and Henry. We will next move to the panel part of our webinar today. It is my honor to introduce you to the very distinguished panelists. Number one, our faculty panelist is Dr. Tung Nguyen. Dr. Tung Nguyen has a lot of honorifics, so I'm just focusing on a few of his titles. He's a director of Asian American Research Center on Health, also known as ARCH. He co-chairs the UCSF Office of Research Task Force on Equity and Anti-Racism in Research. He is also the Associate Director of the UCSF UCSF Helen Diller Family Comprehensive Center, Cancer Center Office of Diversity, Equity, Inclusion, and Accessibility. The next panelist is our learner panelist. Anthony Nguyen is a MD candidate. He's class of 2024, and he is here in the capacity as a APAMSA student leader. Third, we have our staff panelist, Melissa Bautista. Melissa is Assistant Director of the Multicultural Resource Center. She's also co-chair of the United Filipinx Association, and she serves on the steering committee for APASA. Last but not least, we have Ernesto Lamada. He is the Lab Operations Manager and a steering committee member of the United Filipinx Association. Welcome, everybody. I have a few questions for you all. What I will do is ask them one at a time and have each of you respond to it. The first question is, tell us about the organization you represent and its role. Dr. Nguyen, would you like to get started on that?
Sure.
You have quite a few organizations to represent. Choose one.
Yeah, no, thank you, Wiley. Thank you, everyone, particularly for inviting me, but also for having this important event. Someone said it was historic. It's 25 years in the making for me. That's how long I've been here. So it's the first time I've actually been involved in a conversation like this. So I'll talk mostly about the Asian American Research Center on Health. I'm the director. You can find us on the web at asianarch.org. I hope that everyone goes at least to look at it once. We just reinvented our website. It's very nice. We would love it if people actually looked at it and gave us some feedback. ARCH is led by UCSF Asian American researchers, and we were formed in 2011 by a group of researchers, clinicians, and community leaders in the San Francisco Bay Area. We currently have 31 core individual members and 8 core organizational members. And then we have an additional 32 associate individual members and 5 associate organizational members. Most of the members are in the Bay Area, but now we're actually getting people joining us from across the country to speak to both the importance of Asian American health research, but also sometimes the loneliness of doing this work. So a lot of us who live in San Francisco obviously understand a lot of issues around Asian Americans, but to be Asian American in San Francisco is very, very different than being Asian Americans in a lot of other parts of the country, and I think it's important to acknowledge that. We UCSF has been a national leader in Asian American health research since the late 1980s, and our researchers have done work with Asian American patients communities, including almost all the population that Jeff outlined in this disaggregated data. And then the last thing I'll say is that our faculty has been instrumental in advocating for Asian American communities in research and policy across topics such as disaggregated data, workforce diversity, recruitment of research participants, funding for research and intervention, as well as disease-specific policies and advocacy regarding cancer care and prevention, diabetes and cardiovascular disease, tobacco control, hepatitis B and liver cancer, mental health, dementia and aging issues, and COVID-19 most recently. Thank you.
Thank you, Dr. Nguyen. Anthony, would you like to go next?
Of course. Thank you for inviting me. I'm here to represent the Asian Pacific American Medical Student Association at UCSF, or APAMSA. We're composed of learners with leadership from both the School of Medicine and School of Pharmacy. And our mission is to seek to represent, support, and address the unique challenges of Asian American, Native Hawaiian, and Pacific Islander communities. There are founding pillars of community engagement, education, advocacy, and mentorship. Open to students of all backgrounds, APAMSA has been a place where health profession students can connect, celebrate our heritage, and cultivate personal and professional growth.
Fantastic. Glad you're here, Anthony. Melissa, would you like to go next? Would you like to focus on maybe APASA, and then Ernesto can talk about the Filipinx Association? What do you think?
Yeah, let's go ahead and do that. Hi, everybody. It's good to be here. Thank you so much, Wiley, for introducing, and just for all of the organizers for putting on this gathering and really elevating a necessary and powerful conversation. So I'm showing up today serving in two capacities. I sit on the steering committee for APASA, which stands for the Asian Pacific American System-Wide Alliance. And we are a staff organization, and we also welcome faculty part of our organization that's really focused on building professional and personal relationships with AAPI identified staff across the entire enterprise. There's been a lot of movement and growth just within our own organization. And that's really a testament a lot to the efforts that not only members, but the other steering committees, which I know some of them are present here today, we've really been advocating to have conversations that are necessary. For example, bringing Dr. Kim Tran to talk about the presence of anti-Blackness in AAPI communities and ways that we can be in solidarity and advocate for our Black identified community members and relatives that are part of our lives. And also part of having the conversation of talking about how do we include Asian APIs in this conversation around anti-racism here at UCSF. Ernesto?
Yes, so we're involved with the United Philippine Association, and we've been around for about 2 years, and it was formerly called UFEA, sorry about that. And Melissa, Adrian, myself, and other steering committee members got together and formed our group. And we've only been around for 2 years, and we already have 120 members, due to the pandemic and whatnot, and word of mouth, and also, trying to recruit from other different parts of the UCSF community, whether it be Parnassus, here at Mount Zion, where I work, in Mission Bay. So, and trying to get together with everyone, it's kind of hard as far as recruitment, but as far as what we're doing, we're trying to be grounded in our CAPWA, which is interconnectedness. It's a core Filipina X value that we kind of honor, and we try to serve as a reference to all Filipina X at UCSF, forming a community where no one's left behind. And we just want to commit ourselves to be a stakeholder representing the Filipina X voice and shaping the culture of belonging, equity, and diversity at our institution. And our aim is to realize through an open sharing of resources, social gatherings, and various workshops to foster personal and professional development.
Thank you, Ernesto. That is really impressive. It really speaks to the need of your organization. My next question is, what successes or challenges do you see Asians and Pacific Islanders face within UCSF?
Do you want me to take
Sure.
that? I didn't know which order you wanted to go.
Go for it. Let's take the same order. How's that?
So I think the data that Jeff and Henry presented was great, and more or less summarized up a lot of the things I would say. I think the main successes that we've had at UCSF is that we have reasonable representation of the overall AAPI population, particularly at the early mid-level staff, trainees, and faculty. But even there are some groups that are underrepresented, including Southeast Asians and Pacific Islanders. We are not at all well represented in the leadership level, whether for staff or faculty. There's also issues around equity and inclusion, which isn't really apparent in the data necessarily. Certainly things that I hear, sort of anecdotes about how people are treated, particularly those who don't speak English as their first language, and how they're treated on a day-to-day basis by their colleagues and their supervisors sound kind of terrible. We haven't even talked about intersectionality issues like issues that API women or LGBTQ plus population or disabled APIs have to face. And so, and even because even in those advocacy spaces where, like, for example, you were fighting for women equity, API women are always de-emphasized there. And it's the same for the other population as well. So I think these intersectional issues needs to be addressed. And vice versa, actually, when we talk about API equity, sometimes we don't talk about LGBTQ plus APIs or disabled APIs. So I think we need to be very careful about how we frame some of these things. And the last thing I would say, though, is that as a primary care physician who's been taking care of primarily Asian American patients particularly a lot of limited English proficient patients here for 25 years, our patients experience a lot of disparities in culturally and linguistically appropriate access and concordant healthcare here. I'd actually feel like after 25 years that we're just not really meeting our mission in providing good care that's appropriate for our AAPI patients.
Great. Thank you so much for that. Anthony, your thoughts?
Of course. Thank you, Dr. Nguyen. To add upon that, I feel like most of our successes and challenges have been rooted upon the culture of advocacy here at UCSF, along with our populations here in the Bay Area. With a third of our patient population, our community identifying as API, we've had much voice and priority when it comes for the need of support in times of strife and racism targeted towards our community. With the PAMS and the learner perspective, we've seen numerous promotions of community efforts, rallies, vigils, student and faculty support circles, interprofessional and minority solidarity, as well as a reinvigoration toward advocacy from API identifying folk. Nevertheless, there are still many challenges that still prevail, and one of it stands as the historical myth of being a model minority. With so many advocacy efforts here at UCSF, some may question if us speaking up will overshadow or take away from the advocacy needs of others. But yet it's a double-edged sword, as if we don't speak up for ourselves, who will? As such, I still see one of the large challenges, like especially from a learner perspective, is finding a venue to raise and build our own collective voice.
So true. Thank you, Anthony. Melissa?
You know, I've been thinking a lot, and I know in APASA we have these conversations around, you know, Asian Americans and Pacific Islanders, you know, we're not a monolith. So when we're thinking about our histories, even our migration stories of our families and communities, there's a lot of complexity there, right? And I think what I would want from our own staff groups, as well as the institution, I think there is a lack of representation from the Pacific Islander, Native Hawaiian communities at UCSF, from the students to staff to faculty. And, you know, we can also see this in terms of programming, right? And sometimes there is that critique of when, you know, we're in this month of Asian American and Pacific Islander heritage, but what of our programming are we actually utilizing our position and our power in really uplifting communities that might not necessarily have that much visibility. So that's one challenge that I wanted to uplift. And in terms of successes, I always like to end on like a higher note, just thinking about everything that has happened impacting the API community in this, you know, past 2 years, specifically around anti-Asian violence. I feel like the Asian American community here at UCSF really responded to provide and to show up, you know, for our members that were in deep pain from just the very visceral and visible acts of violence that were happening and are continuing to happen. And I also know from the student perspective, as somebody who is learner facing, that there was a lot of collaboration, right, to also provide those levels of healing spaces.
Thank you so much, Melissa, and I appreciate you lifting up the minority API population. Ernesto, would you like to go next?
Yeah, just to mimic what Melissa said, we definitely are represented here at UCSF as far as being successful on that level. But as far as the challenges, there's still not enough upper management representation, like Jeff mentioned earlier. And as far as like what we're doing here, this is great. I mean, we established this group last year, but you know, we can't get together like every year. Like just because it's Asian American Pacific Islander month, you know, there's no like follow-up with us. We all have to get together as, you know, as a group and say, hey, you know, do something every month, whether it's just 3 or 4 of us talking or whether it's 50 of us talking. So I think as a collective group, we should, you know, make some type of effort. I mean, there's many groups out there, AAPIC, APASA, this group, our group. So, I mean, I don't know what it's going to take. I know this is another type of job that somebody else has to do, and we all already have our jobs, right? So this is like, we're volunteering to do this, but we stand for what, for what is right, and that's why we're all here. So I mean, I'm just saying, maybe just more follow through within our community.
Thank you so much for that, because it's a nice segue to my next question, which is how can UCSF better support the Asian and Pacific Islander community? Dr. Nguyen, would you like to take that first?
Yeah, so we can just take whatever I said about the negative and flip that around. But I think primarily diversifying its leadership, both at the staff and the faculty level. I think it's a little bit easier when you're dealing with leadership that you don't have to explain things to them. A lot of times when you go meet with the leaders, you have 30 minutes and you spend 20 minutes of explaining the needs and 5 minutes talking about the intervention or the change that you need. And it gets tiring after a while, So increasing the diversity in the leadership is important, not just for representation. It's also about getting things done. I don't have to talk to someone who's an Asian leader about disaggregated data. I never do. I mean, because they don't need to be convinced that that's important. It's just a question, okay, do I have the resources? What's the project's going to look like? How are we going to evaluate the projects? Things like that. So I think that's really important. Disaggregation is important. I was glad that Jeff was able to show disaggregated data for the staff. That isn't always available for many, many things that we do. As a researcher, I care a lot about data, but I also care about visibility, and the lack of disaggregated data really is not simply about data. It's about invisibility. I mean, we can't talk about invisibility without talking about not seeing people for who they are. So we lump us together for power as AAPIs, but we also need to see each group individually for what they are. And if we don't collect the data that way, then we're saying we don't want to see you that way. And that's really important. And then I think the whole patient issue we can talk about a lot more. But I also think we need to do more community engagement with AAPI communities. I mean, first of all, many of our staff members are living in the communities around us. And so they are by default community members as well as employees. And they live in the communities and they deal with a lot of stuff in the communities and they take it to work and vice versa. And I think we need to not just simply look inward all the time. I mean, if we're just trying to improve UCSF, that's great. But we need to improve the situation for all Asian Americans with Islanders, particularly around where we live.
Absolutely. Thank you so much for that. Anthony?
Yes, I believe that support comes in two forms. First, the verbal acknowledgement and start of a discussion, and second, the actions to back up any promise that was given. It was with great faith that we started our AAPI coalition to bring to light the core issues that we face in our communities. And it's with great promise that we were able to meet with UCSF leaders, including the CEO, Chancellor, Provost, and more. And it will be with great expectations and hopes that we will continue to see such actions that we talked about carried out in the near future in our institution. As support for a community is closely tied with morale, community members need to see change, and change, whether that be starting up these pipeline programs for AAPI students, public statements condemning xenophobia and anti-racial intolerance, statistically significant changes in uplifting AAPI representation for AAPI faculty and staff salary equity, as stated, or strengthening language access for patients, or more. They all need to come to light to show that UCSF stands with our community. In short, support isn't just about talking the talk, but we need to see UCSF walk the walk.
Thank you. Appreciate the push from our young people. Melissa.
I just want to say that I'm deeply resonating with what the rest of the panelists have shared so far. And I'm thinking a lot about Adrienne Marie Brown. She's a Black queer writer, and she wrote about emergent strategy. And there's this principle called small is good, small is all, the large is a reflection of the small. And when we're having conversations, I think, around equity and inclusion, it's really important to name that this work is deeply rooted in relationships. Right. And I'm just remembering an event that APASA hosted last year with really celebrating, elevating APIs in senior leadership. And there was something that was so powerful about their narratives and their stories. So I think this is more of an invitation, right? Is how can folks that are in positions of power, how do you humanize and how do you actually build relationships with us? And for that to also be consistent, right? Because I think there's power in just showing up, whether that's attending our events or checking in or, you know, responding to an email. And I think once we kind of strengthen that relationship, then we're going to impact things on the institutional level, on the systemic level. And I also think I know there's a lot of different offices and departments that are doing amazing work in the community. So I really appreciate Dr. Nguyen for bringing that up around how do we actually bring more of our community to UCSF, right? And us being an institution, it could also be almost like an incubator of thinking about how can we create multiple possibilities and making sure that we're centering the people that, communities that we're part of, but also people that we want to support in.
Thank you, Melissa. Ernesto, do you have any additional thoughts on that?
Yeah, just to add on what Melissa just said, as far as leadership and showing up to have us become in solidarity together. Recently, this past Friday, the president, Suresh Gunasekaran, had a fireside chat with APASA, and that was great. So we kind of like heard all of our voices, or, you know, for the most part, it was a great conversation with him. And like what Melissa was saying, if we can get more leadership like that, I mean, that's pretty much the cream of the crop, other than having, I'm drawing a blank here. Anyways, what I'm saying is, yeah, just to have more leadership, just hear our voices and go from there.
Great, thank you. I know we're almost running out of time. I do want to ask one last question, and maybe not everybody needs to answer. Whoever feels the desire to do so, please do. So our country is still reeling from the massacre on the Black community in Buffalo, New York. How can we as Asian and Pacific Islanders better collaborate, uplift our collective anti-racism efforts with our Black, Latinx, and even other communities of color within UCSF? Any thoughts and reflections on that?
Yeah, I can take a crack at that. In 2000, I started chairing, after the George Floyd murder, I chaired I co-chaired the Office of Research Task Force on Equity and Anti-Racism in Research, with a specific focus on anti-Black racism. The good news is that report's actually final. I just saw the final document. It's going to come out early next month, so you can actually see the work. But really, the main thing that we have to think about is coalition building. I actually think, we have to have a fight against anti-Asian racism. I think we have to have a fight against anti-Black racism, but we're not going to be successful in either place if we don't do it together. Because really, you think about structural racism, that's what it wants. It wants each of us to fight for ourselves, because then we end up being in conflict with each other, and then we're fighting against each other for the scraps from the table. And while we're doing that, we're not noticing that we're not at the table, or that we're not getting any of the good stuff, in the menu, So that's, precisely why the model minority myth was created in the civil rights movement. It was deliberately created to separate the Asians from the rest of the people of color, so that, and then the whole sort of everything that we're seeing these days really resulted from that one structural, really racist decision to do that. And it hurt both of us. It hurt other peoples of color, and it hurts Asians. And if you wanted to see what the outcome was, that was the outcome. So it wasn't that we should be fighting for ourselves or others. We need to be fighting together. I think one very practical thing that we could do is every one of these meetings, when it's about Asian or about Black, that we should be represented, the other group should be represented always. I actually think it's much more helpful because, one, we can see the commonalities, but two, we can also begin to fight for what the underlying problem is, right? The underlying problem is not anti-Black or anti-Asian racism, it's racism.
Absolutely. Thank you so much, Tom, and congratulations on the report. I was just told that we're running out of time, and thanks to Jeff, he's been answering some of the questions in the Q&A in chat. Thank you so much for that, Jeff. What we will do now is maybe have our co-chairs of the AAPI Coalition, Dr. Don Ng and William Ho, give some concluding remarks. Thank you so much, everybody, for joining us.
All right, well, good afternoon, everyone. My name is William Ho. My pronouns are he, him. As a co-chair of the AAPI Coalition, along with my colleagues Don Ng and Henry Ocampo, I'd like to thank all of you who participated in this event for your time and commitment to improving the climate of UCSF for A and HPI identifying individuals. We're especially thankful for our special guests, Dr. Hanmin Lee and Jeff Chiu, and our panelists, Dr. Tung Nguyen, Anthony Nguyen, Melissa Bautista, and Ernesto Lamato, for making the time to be here and to share their perspectives with us all. The sharing of information is critical for us to critically evaluate where we are now and determine where we must set our sights for the future. We'd also like to give our thanks to our colleagues on the AAPI Coalition Steering Committee who helped make today's session possible. We thank our colleagues on the AAPI Coalition Steering Committee, especially Henry Ocampo, Wiley Liu, and Tiffany for bringing us all together today. We really also want to thank Educational Technology Services for supporting us in this event. And we also want to recognize that a lot of our colleagues here at UCSF may not have been able to attend live, but we remain committed to allowing them access to this information through the recording of this event. So if you would like to see recordings of this or other events from APA Heritage Month, please visit the APA Heritage Month pages on the Multicultural Resource Center or Benioff Children's Hospital's website.
Thank you, Henry. As we conclude today's session, we'd like to reflect on the large amount of work ahead of us. The identities within the Asian American, Native, Hawaiian, Pacific Islander community is very broad, very diverse, and yet we need to work with each other and for each other so that we can uplift all of us. I think during our discussion with Chancellor Hoggood, one of the discussions that Chancellor Hoggood last year, he did raise up the issue of diversity and potential conflicts. And I told him, we will work together and we may have our differences, but I think the important thing is that we all work together and realize that uplifting the whole community will help everyone within the community. And we're very thankful for the support and cooperation that the leadership has shown us so far. Appreciate that. We look forward to continuing to work with the UCSF leadership in terms of improving and addressing the issues faced by the API community. I'd like to thank the panelists today for sharing their knowledge about the current status and also what things need to work for the future. We will continue to review all the issues discussed today as well as in the joint statement and to work with UCSF leadership in addressing them and pushing them forward to address the inequities that exist. And to those in our audience, please, if you see practices that really don't fit with equity, practices that are, maybe even frankly racist, please let the API Coalition Committee know, because that's important to us. I think this is an unprecedented time. I've been here for 30 years, longer than Dr. Nguyen. And really, this is the first time where UCSF leadership is willing to listen and to actually help. And so we really need to kind of dig in, look at all the issues, and work together. And true, a lot of it is volunteer. I'm retired, so I have the time to devote to this, but everybody else, has a full-time job. But please, you do whatever you can to join us. There's a lot of work to do, but the leadership now is ready to work with us, and we really appreciate that. So once again, thank everybody for participating in this. Hope that this has been inspiring and informative for you all. And have a great day in the remainder of 2022, and especially the APA Heritage Month. thank you for joining us.